Excellent talk today. Thoroughly enjoyed that. A few questions. So what are the most important components of an exercise program in patients with strokes during that time period that you were highlighting?
Yeah, so I think what we said is that it's the first 12 weeks that we really want to see people getting their interventions. If it's an upper extremity or arm problem, we're looking at using constraint-induced movement therapy, mirror therapy, combining it with electrical stimulation or mental imagery are the key things that seem to keep coming up in the studies. If you're talking about lower extremity, then we really want to add in, core strength exercise and the task-specific training. But a key thing is aerobic exercise, is trying to add that in. And that's sometimes really hard for stroke patients to actually get their heart rate into the right range.
Yeah. And then thinking about some of these barriers that patients with stroke may feel, like fatigue or pain, how do we as clinicians treating these patients develop exercise programs that are evidence-based, but then, facilitate long-term adherence for patients?
Yeah. So things that we're working on is trying to actually do some seated exercise. So my colleague Jana Singh is actually doing a study as part of our trial called VPACE, which is virtual physical activity seated exercise. And the idea is that we really get people into the aerobic range with the seated exercise. We have to adapt. We have a number of adaptations we use to get people aerobic training. They include things like the new step or adapted equipment that they can use to get their heart rate into the right range.
Yeah, that's awesome. And then you highlighted a number of clinical trials that you're running, and that's so exciting. What excites you the most moving forward?
What I'm excited about most is that we're going to try and open up that window of neuroplasticity. That, it seems like after 12 weeks, the brain becomes less able to change. And if we could find medications or biological or stimulation paradigms that would actually change the paradigm of the brain, I think we can open up the window so that we could do a lot more with rehabilitation.
That's awesome. I'm excited to see all of this.
Yes.
Thank you so much.
You're welcome.
Awesome. Thank you.